Okay, so today we are assessing Matt's eyes. So we already did the visual acuity test, far distance and near distance. And then as you can see, his eyebrows, they go from inner to outer and they're pretty symmetrical. His eyes are both symmetrical. I'm going to have you follow my fingers with the H. So follow, ready? Follow. We're going to go back. We're going to go up. And then we're going to go down. Alright, good. So as you can see, his muscle balance in his eyes, they can follow the H, so he has the parallel tracking, and extraocular movements are intact. We would also, check the lacrimal ducts. We'd squeeze them and see if there's any fluid that comes out. As you can tell, there's no abrasions to his eyes. And we're going to test for pleura. Also to note that his sclera is nice and white. His eyelashes curl out. We're also going to test for pleura. So we're going to have you come closer, and we're going to shine line your eyes. So as you can see, keep your eyes straight. So as you can see, they constrict. Also, we're going to check for the accommodation. So I'm going to have you look across the room, and then I'm going to have you look at my finger. So as you can see, he has the accommodation. And then we're also going to have him check for the corneal reflex. We're not going to do it, but if we were to do it, we'd take the cotton applicator and gently touch his cornea and check for bilateral blink response. We're not going to do that, but then again, we could test for it. Now we're going to have you cover your eye. And I'm going to have you tell me when you see my wiggling fingers. They're coming down.
Yep, I can see it. I can see it. I can see it.
Alright, and now keep that eye covered.
I can see it.
Perfect. Alright, so as you can tell, his peripheral vision is intact. We're also going to check his mouth. So his lips are symmetrical. As you can see, can you smile for us? So you can see that his teeth are nice and white. He has, smile again. He has the pink gums. There's no abrasions. His teeth are evenly spaced. Alright, and then I'm also going to have you stick out your tongue. I'm going to have you come closer, though. Stick out your tongue. Alright, so as you can tell that there's no lesions on the tongue. The tongue is midline. Okay, I'm going to have you stick it out again. A little bit wider and say ah. So you can see that his tonsils are intact. His tonsils, though, they don't look tender. Does it hurt to swallow right now? So you don't have a sore throat. And then we'd also palpate his tongue. I'm going to have you smile again. So there's no dental caries. I'm going to have you come back to the camera and stick out your tongue. And as you could tell, head up a little bit. His palate is nice and pink. The inside is nice and pink and moist. Alright, so now we're just going to check the sinuses because they're air-filled, so we're going to put a light source up there, and then we're going to see if there's if it's pink or whatnot, or red. So we're going to go right here, and as you can tell, the sinus, it's pink, and then I'm going to have you open your mouth, and then with the light source there, it should go right in because it's air-filled. Alright, so now we're going to do the whisper test. So Matt, I'm going to have you cover this ear. Alright, and I'm going to stand 2 feet away from you, and I'm going to whisper something, and I just need you to repeat it back to me, okay?
Okay.
Ready? Cat, dog, fork.
Cat, dog, fork.
Perfect, and we're going to do it on the other side now. Alright, and cat, dog, spoon.
Cat, dog, spoon.
Perfect, alright. And so now we're going to do the Weber test. And so I'm going to activate it. And do you hear that more on one side, or do you hear it on equal, or?
Hear equally.
Perfect. Alright. And now we're going to check for bone and ear conduction. So just tell me when you don't hear it anymore.
I don't hear it anymore.
Perfect. Alright. And now tell me when you don't hear it anymore.
I don't hear it anymore.
Perfect. So the bone conduction was around 10 seconds and the ear conduction was around 20 seconds. So your ear conduction is greater than your bone conduction. Alright, and now we're going to assess Matt's nose. As you can tell, it's midline. There's no abrasions. There is a little bit of a slant this way. And then I'm also going to have you come closer. Kind of put your nose up, and we're going to kind of get a light source in there. Alright, so You can tell that the mucosa is pink. There's no obstruction. There's no drainage. I'm going to have you occlude one nasal. So I'm going to have you occlude one size. And I'm going to check for patency. So breathe in, breathe out. Perfect. And I'm going to have you do it with the other side. Perfect. So both nasals are patent. All right. And now I'm going to assess the sinuses. So we're going to assess here. We're going to palpate here. And how does that feel?
Feels fine.
Perfect. No tenderness?
No tenderness.
All right. And how about right here?
Feels great.
Perfect. So no tenderness?
Mm-hmm.
All right. Okay, so now we're going to be assessing Matt's ears. So as you can tell, they're both symmetrical if you look at them from front. But as you can tell, it is 4 to 10 centimeters. It's within 4 to 10 centimeters in length. I'm also going to pull. I'm going to palpate it. So do you feel any tenderness?
No, I do not.
All right, and then right behind the mastoid process, I'm going to palpate again. Do you feel any tenderness?
No, I do not.
Perfect. And we also already took a look inside of Matt's ear. So his canal is pink, his tympanic membrane is gray with bony providence, and there's no tenderness when I looked in your ear, right?
Mm-hmm.
Perfect.